A bill to protect consumers with pre-existing conditions continues to move through the Wisconsin Legislature, but critics say it still doesn't go far enough. We'll remind you where we've been with protecting pre-existing conditions and then where we think we're going. Now, generally, protecting people with pre-existing conditions is federal law. It was written into the Affordable Care Act. The individual mandates that everybody has to have insurance or pay a penalty. Insurance companies can't charge people with health conditions more for that coverage. And the coverage they get is good. It covers the essential health benefits. It's comprehensive coverage. And by the way, it doesn't have any lifetime limits or annual caps, so it's a robust health insurance plan. That's what's written into the Affordable Care Act. How did the Affordable Care Act do it? Because that could be quite pricey for consumers to have that robust insurance that includes protections with people with very chronic health conditions. Well, they did it by saying you have to have insurance. So they grew the risk pool. That means that healthy people with no pre-existing conditions have to buy insurance also. So they grew the risk pool to try to spread that risk and bring costs down. They then added market stabilization measures, reinsurance, risk corridors, risk adjustments, mechanisms to try to stabilize costs and spread risk. Now, a lot of those were contentious because we had a legislature, a House and a Senate, that were not too happy with the mechanisms to do that. So that kind of fluctuated over time. There was then premium assistance that came in the form of advanced premium tax credits to make sure that the consumers weren't paying higher premiums for this more robust coverage. And there were cost-sharing reductions, ways to bring down some out-of-pocket costs as well. And these were things that many healthcare advocates consider just to be common sense consumer protections written into the federal law. Then fast forward, we have yet another fight over the Affordable Care Act. Wisconsin, where we are, was one of the states that vigorously joined the lawsuit, Texas versus the United States, that wanted to get rid of the individual mandate and pretty much repeal the entire Affordable Care Act. Now, there were a lot of challenges to the Affordable Care Act over the last several years. This is the most recent attempt, but it's the one that has the most likelihood of success just because of the courts that it's in, the administration that we have, and the climate that we have. The Texas versus United States case looks to strike the individual mandate, guaranteed issue, and community rating provisions of the Affordable Care Act. And the way that the lawsuit was written, it said, and by the way, if that falls, then you can't have the rest of the Affordable Care Act either. So in January of last year, January 2018, Wisconsin's then Governor Walker said, I'm going to introduce the Healthcare Stability Plan. If the Affordable Care Act falls, then we would like to have something on the books that protects people with pre-existing conditions. That was written into Assembly Bill 365. That made its way through the Assembly, and it did not make it out of the Senate. Then fast forward, we had a lame duck legislative session at the end of December of 2018, and AB 365 once again reared its head, and they started to debate that of whether or not that should be what is the rule on the books in Wisconsin, and that again failed. So 2 attempts at AB 365 did not succeed. And for a lot of reasons, the arguments against it were first of all, it looks nothing like the federal protections. It hardly does any protecting at all. Second of all, it had language written into it that looked like the battle days of insurance of creating high risk pools and pooling your sick people together and keeping them separate from the healthy people, which kind of doesn't really bring down costs at all. It just spikes cost in that one pool. And then it also didn't get rid of any of the other consumer issues that people were thinking about. It kept lifetime and annual limits. It didn't guarantee any coverage guarantees like the essential health benefits. It had a lot of shortcomings. Those did not succeed when tried. Let's now fast forward. We're now in 2019, and there was a new bill called AB 1 at the start of the 2019 session. AB 1 is pre-existing condition protections for people in the state of Wisconsin, and it looks different than AB 365. It just simply says if you have a pre-existing condition, you can buy health insurance in the state of Wisconsin. That got a lot of debate in the Assembly Health Committee. There were a lot of amendments offered that said, well, you should make sure that there isn't a lifetime or annual cap on those plans. You should add essential health benefits. You should add some of these other consumer protections that the ACA envisions. And by the way, you're never really going to fully get to the ACA protection because that's federal law, and that covers not just the state-regulated plans like AB 1, but the federally regulated self-funded ERISA plans as well. You're never going to have that with the state law. That's why you need this to be a federal law. So there were a lot of arguments in the Assembly Health Committee. This AB 1 made it out of the Assembly Health Committee. It was passed. It then made it through the full Assembly, and now there is a Senate version of the bill, AB 2, that has surfaced at the same time. So we have AB 1 in the Assembly. The Senate version might look a little different. Now, the one amendment that stuck was the not allowing there to be annual or lifetime limits on insurance. That's the only extra provision. So no discriminating against people with pre-existing conditions, and insurance companies, you can't set an annual limit or a lifetime cap on somebody that has insurance that also has pre-existing conditions. That's where AB1 sits right now. It's going to get some debate. It had to go to the insurance commissioner for review, and it's not a done deal yet. Many people have said the shortcomings continue, and here's what they look like. There's no mandate to provide major medical coverage. There's no tax subsidies and no cost-sharing reductions that goes along with this. There are no essential health benefits. It doesn't have to cover anything. There's no impact on federally regulated plans, like we said, and there's no anti-discrimination language like the Affordable Care Act has. So we've got a series of concerns here that says this bill, AB1, if signed by the governor, which is a big if because it's a new governor now, if AB1 is successful and is signed by the governor, it only takes effect if the ACA is repealed by that litigation, Texas versus the United States. If Texas versus the United States leaves the Affordable Care Act intact, AB1 just disappears. It's not a thing. It's only conditioned upon the repeal of the Affordable Care Act. So if that happens, then you get this language in Wisconsin law that's meaningless, that says you can protect people with pre-existing conditions, but you don't have to cover anything. You could charge them a fortune for it, and we're not going to prevent the insurance companies from discriminating against people based on age, gender, religion, whatever. So it's really a paper as loose as a piece of paper. Here are the concerns summed up into 4 categories. Exorbitant cost. If the ACA fails, so does reinsurance, so does tax credit, so does cost sharing reductions. This bill, AB1, Senate version 2, that doesn't take care of that concern at all. What coverage? If you say people with pre-existing conditions can have coverage, but you don't cover essential health benefits, then you're covering nothing. You're not providing any guarantees whatsoever. Discrimination returns, and this is what we were talking about. The ACA anti-discrimination language says insurance companies cannot discriminate based on race, color, national origin, sex, age, or disability. And finally, what's the biggest concern? If you have all of these protections that go by the wayside, you're going to start seeing that rate of uninsured start to skyrocket again, like it did before the Affordable Care Act was even signed into law. So why now? Because that ACA lawsuit is still on appeal, and we don't have a resolution to that now. Governor Evers indicated his intent to withdraw from that Texas versus United States lawsuit. Another thing coming out of that lame duck extraordinary session was the legislature and the former governor signing off on the fact that we cannot withdraw from that lawsuit. So now it's up to our new governor and our new attorney general to decide what their next steps are, what their path forward is. So they're evaluating what options they have to withdraw from that lawsuit. In the meantime, you can read this new bill, AB1 SB Senate version 2. And see what the language looks like to you. Maybe there's more there that you see. You can definitely share your comments with us or ask us a question. You can do all of that at healthwatchwisconsin.org.